Before working with any patient, what's most important to prevent any type of infection is to wash your hands. So I'm going to show the proper technique for hand washing. You want to use a comfortable water temperature. Usually you want warm to hot, whatever is comfortable for you. And you get the water to where you want it to be. And then you wet your hands thoroughly, pointing your fingers towards the sink because your wrists are the cleanest spot and your fingertips are the dirtiest. So you want to run the dirt away from your hands. Once your hands are wet, you would apply some soap. You really want to work your hands in with soap, and you want to get between your fingers and between your knuckles and the tops and bottoms of your hands. And you want to start at your wrists and go towards your hands with your fingers always pointing towards the downward position. While you're doing that, you want to make sure, you're kneading your hands together and your fingernails are clean and stuff like that. And then when you go to rinse your hands, what you want to do is you want to make sure that all the soap comes off and that you don't touch any sides of the sink or anything like that because you'll have to start the process over. Before turning the water off, what you'd want to do is you'd want to get a clean paper towel, and you could start to dry your hands off. And the best way to keep your hands sanitized is to turn the water off with that towel, and then throw that away. And to complete this, you want to make sure your hands are completely dry because moisture is what bacteria need to grow. So, how are you doing, Colleen? I'm your nurse today. My name is Kevin. I was wondering what you were here today for.
Just a physical.
Just a physical. Okay. Do you have any other medical conditions that I need to know about or anything?
No.
Okay. Do you want any medications right now?
Just a multivitamin.
Just a multivitamin. Are you allergic to anything?
No.
Do you have a family history of disease or anything like that, or diabetes?
No.
Okay. That's it. Alright, Colleen, now I'm going to check your height and weight. So if you wouldn't mind standing in front of the scale with your shoes off. If you can put your back against there and make sure that your feet are flat and you're standing tall. You use this. Okay, make sure this sits flat on top of your head. Okay, would you step away from the scale? Alright, so I have your height at 64 inches. So that would make you 5'4".
Yep.
And now I'm going to check your weight. So if you wouldn't mind coming and standing over here. You don't have anything heavy in your pockets or anything, right?
No.
No heavy clothing on. Okay, would you mind stepping on the scale for me? It's calibrated to 0 right here. So where would you like me to start roughly? Do you know your weight, Colleen?
About 120 pounds.
About 120. Okay, so I'm going to move the big one over to about 100. And then on the bottom, I'm going to move it over. And I have it balanced right here at about 121 pounds. So that's a healthy weight for you.
Right.
Alright, Colleen, now I'm going to take your temperature to find out if you're doing all right internally. I'm going to place this under your sublingual pocket in your mouth for a few seconds. I'm going to hold it in place. So if you could just allow me to do that. Beep, beep, beep. Your temperature read at 98.7, which is perfectly fine. The golden range is 98.6, but you could be anywhere between 96.4 and 99.1 is a safe range to be in. So you're very good at that.
Okay.
Alright, Colleen, now I'm going to check your pulse. So if you wouldn't mind giving me your left arm, I'm going to check your radial pulse. And what I'm going to do is I'm going to count to 30 seconds, and I'm going to multiply by 2. Okay, in 30 seconds, I had you at about 40 beats, so that would put you at 80. And the range is 60 to 80 beats per minute, so you fall right in the middle, which is healthy. When checking that, I noticed that there was no irregular beat at all, nothing irregular. Your elasticity was spongy, your arteries are good, they're not hard, they're not tough. And I noticed that your force was a 2+, which is normal for the healthy patient. if you wouldn't mind now, what I would normally do is I wouldn't make the patient aware that I was checking their respirations, but I'm going to ask Colleen to place her arm across her chest or across her abdomen, and I'm going to count her respirations for 30 seconds. Alright, Colleen, I had you at about 14 respirations per minute, and the normal range for a healthy adult is 10 to 20, so you fall in that category. I noticed that you were sitting and you didn't seem labored. You weren't using any of your accessory muscles or anything like that. Your chest rose and depressed with a symmetrical expansion, which is good. Other than that, I believe. Alright, Colleen, the next thing we're going to do is I'm going to check your blood pressure. In order for me to do that, I'm going to make sure that your feet are flat on the ground and uncrossed. Make sure that you're sitting upright, and I'm going to support your arm on the table at about the level of your heart. With my stethoscope, I'm going to use the diaphragm side, which is this side, when checking. When choosing the right blood pressure cuff, I want to make sure that this is going to cover at least 40% of your arm and go about 80% around. I'm going to line up the artery on here, the artery mark on here with yours. When putting this on the patient's arm, you want to make sure that it's not too tight and not too loose. You should only be able to fit about one finger underneath it. Now, when I place the blood pressure cuff, I also need to make sure that it is roughly an inch above where the break of the elbow is in order to get a correct reading. So if you wouldn't mind, I'm going to just take a listen and see if I can get your blood pressure for you. So what I'm going to do is I'm going to inflate the blood pressure cuff until I no longer feel your pulse. And when I no longer can feel it, I'm going to go a little bit above that and stop the pressure there. And then I should be able to get an accurate reading. Alright, Colleen, I had your blood pressure at about 110/70. The gold standard is 120/80, but for an athletic woman like yourself, I'm sure that you fall within the normal range.